Good morning. Today we will discuss on the topic impression making in complete denture. So as we all know, impression making is the first step in fabrication of a complete denture. And we should have a thorough knowledge about the anatomical structure, anatomy of the supporting and limiting structure for fabrication of a proper denture with proper extension and support. So the technique of impression will vary according to the clinical situation. Now, these are my contents. Coming to the introduction part, how will you define an impression? A negative likeness of OP of reverse surface of an object, an imprint of teeth and adjacent structure for use in dentistry. So what is a preliminary impression? As we all know, that is the first impression we make in a fabrication of complete denture. A negative likeness of for the purpose of diagnosis, treatment planning, and fabrication of the tray. Now coming to the requirements, always the preliminary impression should able to record the entire denture bearing area. It should record all the sulcus extension, and also it should ensure that the anatomical landmarks are recorded. And we can use different material for recording a preliminary impression like impression compound, irreversible hydrocolloid, and silicon putty materials. Now selection of a tray. For a preliminary impression, we can use a stock tray that is of two types, perforated and non-perforated. The perforated tray is mainly used for irreversible hydrocolloid like alginate. And if we are using an impression compound, we have to use a non-perforated tray. That is based on the material that we are taking, we have to select the tray. If we are using a silicone putty material, we have to use tray adhesive for retention. Now, selection of size of tray. For in the case of maxilla, you have to use a divider. Place the divider buccal to the maxillary tuberosity region, and we should correlate that measurement with that of the tray. And the tray size should be 5 mm larger than the residual ridge that we are going to record. Now, positioning the patient. The patient should sit upright. Head, neck are in line with the trunk. Head upright. And the doctor position is rear right position. And the mouth of the patient should be at the elbow level of the dentist. Coming to the preliminary impression with an impression compound. So as we said earlier, we selected the non-perforated tray. We check that in the patient's mouth, whether all the extensions are correct or not. Once that is done, we have to manipulate the material. For that, we put the impression compound in hot water, 60 degrees Celsius, and knead it to achieve a uniform thickness. Once that is done, make into a ball and placed in center of the impression tray. Once that is done, spread that evenly with the thumb into the tray that is selected and insert that in the patient mouth. Always insert from the right side and rotate into the mouth. And patient is instructed to slightly close the mouth, lift the upper lip upward and forward, and tray is seated anteriorly. Now seat the tray posteriorly until the impression contact the ridge. Now apply a backward and upward force with the index finger until the material flow into the vestibule. Now the cheeks and lips are molded. Ask the patient to slightly open the mouth and move the mandible sidewise and hold the tray until the material set. So once that is done, remove the tray with a downward and forward motion. And this is the picture of a completed maxillary impression with the impression compound. If you are taking an impression with an irreversible hydrocolloid, a clearance of 2 to 3 mm will be sufficient for the material. So the alginate will be mixed in thicker consistency and loaded in the perforated tray. And the tray is inserted in the patient's mouth. And once the material is set, snap the tray and remove it and rinse, dry, and evaluate for any kind of deficiency. And this material, we have to pour the cast immediately. Now, coming to the preliminary cast. Once you made the preliminary impression, you have to pour the cast. For if you are making an impression with an impression compound, you can use a inversion method for fabrication of the preliminary cast. So mix the plaster in a water bowl and pour the cast from posterior end and allow to flow to that of the other end. And the cast, once the cast set have an initial set, plaster have an initial set, make retentive grooves over it and place a block of plaster on the tile or a ceramic tile and inverse this cast in onto it. Once that is set, the cast should immerse in water bath for 65 degrees Celsius for 5 minutes for retrieving the cast from the tray. Now the final trimming is done according to the recommended dimensions. So this is the completed preliminary cast. Now coming to the custom tray. So according to GPT, a individual impression tray made from a cast recovered from preliminary impression. It is used for making final impression. So why you need a custom tray? That is to confine and control the impression material, to obtain the minute details of the denture bearing area, to develop a proper seal, and for a uniform thickness of the final impression material. And it will ensure a distribution of pressure on the residual ridge. So a custom tray should be rigid, dimensionally stable, easy to adjust, easy to construct, and smooth, should not have any sharp edges. Now coming to the different types, we have a custom tray with spacer. In the case of ideal ridges, we can use a custom tray that is 2 mm short of the vestibule, and we should, before fabrication of the custom tray, we have to adapt a spacer of 2 mm thickness, which is 2 mm short of the custom tray, and it should extend only up to the anterior vibrating line. And tissue stops should be given. Why we have to give a tissue stops? These are the tissue stops of a dimension 2x2, and 4 stops will be given, 2 in the canine region and 2 in the molar region. That is for stabilization of the tray while we make the impression, and it's also for equal to identify the uniform thickness of the impression material. So once that is done, this spacer will act as this will give the space for the final impression material. Now custom tray with a relief, that is for this kind of spacer designs are given for selective pressure impression technique, in which relief pressure will be given only to the stress bearing area. So the spacer will be applied over the area where relief is indicated. Once that is done, in the preliminary cast, we mark the spacer design, custom tray extension, and sulcus depth. Once that is done, we adapted the wax spacer over it. After that, we fabricate the custom tray. Custom tray can be fabricated in 2 methods. There is spring-on method is the Dow method is the. In Dow method, we manipulate the monomer and polymer and make into a Dow stage and yield it into a ball on the glass slab and directly adapt that onto the wax spacer. So once the custom tray is made, we have to make a handle that will give the angulation for the central incisors. It have a 15-degree angulation, and it will be have a dimension of 8 mm height, 8 mm width, and 4 mm thickness. Now coming to the final impression, the impression that represents complete registration of the surface of or object. So for a final impression, so first of all, we fabricated the custom tray and check its extension in the patient's mouth, and the spacer is removed only after the border molding. Now coming to the border molding, determining the extension of the processes by using tissue function or manual manipulation of the tissue to shape the border area of an impression material. This is to create a peripheral seal. So there are 2 methods for border molding: incremental or sectional border molding is the, and single take method is the. So coming to the incremental method, first of all, we add the material on the sectional basis on the labial flange, buccal flange, like that. So the labial flange, there is passive and active movement is there. Passive movement is done by the dentist, active movement is done by the patient. So passive movement is that elevate the lip and extend that outward, downward, and inward, and ask the patient to pucker the lip and suck on the dentist finger. So this is the border molding done for the labial flange area. Next one is the buccal flange. Buccal flange passive method is the elevate the cheek, pull that outward, downward, and inward, and move backward and forward. For the patient, ask the patient to pucker the lip and smile. In the distobuccal area, passive method is pull the cheek outward, downward, inward. Active method is ask the patient to slightly open the mouth and move the mandible to side movement. By opening the mouth, that will determine the width and depth of the distobuccal flange area. And by moving the mandible side to side, that will accommodate the movement of the coronoid process. Coming to the posterior palatal seal area, we have to ask the patient to say ha in short burst. This was the border molding in incremental method. And in a single step, we have using a putty or heavy body elastomeric material. We will be applying the material after tray adhesive is placed. We'll be applying the material entirely in one step and ask the patient to do the movement simultaneously. We have to do the passive movements. Now preparing the tray for the final impression. So once we are done with the border molding, we have to remove the wax spacer. Even if we are not placed the wax spacer, we have to create the space for the impression material by removing 1 mm of the resin from inside of the special tray. Then material over the PPS is not removed. After that, holes is placed for over the relief area. Now we will make the final impression. Once that is done, place the tray, load the tray with a impression material like zinc oxide eugenol. If you are border molding with a green stick compound, we can use a zinc oxide impression material for the wash impression. So place the material evenly on the tray, and the tray is inserted carefully, aligning the labial notch in the tray with the labial freener. And use the index finger to apply an upward pressure in the molar region until the tray seat posteriorly in hamular notch. Hold the tray in position by holding it in the palatal region, and do the border molding movements again. All the passive movements are done. That is outward, downward, and inward movement. And hold the tray in the mouth until the material set. Then remove it. So this is the final impression with a zinc oxide eugenol impression paste. And this is a regular body elastomeric impression material. So once that is done, we have to pour the definitive cast. That is the replica of the tooth surface, residual ridge area, and other part of dental arch or facial structure used in fabrication of dental restoration or processing. So this is the cast on which we are going to fabricate our complete denture, which have a proper extension of sulcus, which have all detail of anatomical areas, and or recorded all the denture bearing areas are well recorded in this master cast. So for making a master cast, we have to do the beading and boxing of the secondary impression. So this is the beading that is done. A beading wax is adapted over the secondary impression at 45-degree angulation, and once that is done, boxing wax is adapted according to the height of the cast, and the plaster is poured in this. The dental stone is mixed and poured into this, which will obtain a final definitive cast. So this was the steps different steps in making an impression for CD. So unless and until we get a proper extension of sulcus and details of anatomy, we could not be able to fabricate a processes which have proper extension and support. So always make sure the border molding movements are done well, and we should able to get a good definitive cast for success of a denture. Thank you.